Well, I fractured a hamate bone at work
All right.
using a steel-handled sledgehammer.
Ooh. Oh,
And
no.
the doctor
Okay.
cannot find it, even though it is clearly visible on a bone scan.
Okay. If you can see it on a bone scan, okay. And for those that don't seem to understand how X-rays work, okay, an X-ray gives you a shadow. You know, you're blowing radiation through something. The calcium in the bone absorbs some of the radiation, and that which is left casts a shadow. Okay, so if you have a fracture, typically there's a lucency. There's a kind of like a white line. But if you crush a bone, you may not see that. So a bone scan, which is exactly the right thing to do, actually tells you a little bit different piece of datum. What it tells you is where the bone is either overactive, okay, which is usually what happens after a fracture. It starts to ramp up and it becomes a hot spot on a bone scan. So you crushed your hand with a hammer. Okay, so now you have two spots that are broken, but they can't find them in what manner, either with an X-ray, fluoroscope, MR, or digitally. How can they not find this?
Well, I've already had surgery, and he forgot to look at the hamate while he was in there during open carpal tunnel release, and he went to my index finger instead.
That's nonsense. Okay, all right. I would have had a word or two with them. Okay, so the crushed bones don't necessarily need surgical intervention. That being said, without really looking at it, there's no way to know whether or not it needed a pin dropped in it. If the fracture is such that it needs to be pinned, it can be done after the fact. Okay, did you go to a hand surgeon or just a general surgeon, orthopedic surgeon? Who did you go to?
I went to a hand orthopedic surgeon.
Okay, he should know better than that. Okay, what did he tell you that the next step was going to be?
He didn't tell me there was going to be a next step. I was told that I was medically
cleared to go back.
Stationary, and he was going to put me for a work capabilities test.
Okay, all right. There are a couple things I'm going to suggest that you do. Was this your right or left hand?
Actually, it was my right hand first, and then I did it when I was released for work to my left hand also.
Okay, so in the differential diagnosis would be clumsy. Okay, so Jeremy, there are a couple things that you need to do. Now, what I do in my office when this sort of thing arises is I'll use a diagnostic ultrasound. Okay, and you can actually see where the step off is with the ultrasound, and there's no radiation involved. It's pretty darn quick, and it looks. I mean, it's a fine way to do it. I was looking at a gal's fractured humerus this past week. You know, she came in, the arm looked terrible. She broke it. They told her just to splint it, that it was a non-displaced fracture. But every time I touched her shoulder, it looked like there was a joint where there wasn't. Okay, if you know what I mean? Yeah. It's not a good thing. So I ultrasounded it, and sure enough, there was the step off, but it was not an unstable fracture looking at it from the ultrasound. So you can go that route with it. But if it's not a surgical situation, in other words, it's not one that needs to be pinned or opened to be pinned, and it's a matter of comfort, and this sounds like a workers' comp injury. If it is, it's extraordinarily easy to deal with, but you would be the person that I would have get the Pensaid, that's spelled PENNSAID, gel. It's a 2% diclofenac gel. You put that stuff on, just a couple, 3 drops, maybe a little bit more over the fracture line, and the pain goes away. Okay? Now, you're going to say, well, do I really want the pain to go away? And the answer is, of course you do, because what you're really doing is you're knocking the inflammation down. It will heal. It'll get better. As long as that crush did not damage the flexor tendons of the hand, or even less likely the extensor tendons of the hand, you should do okay. But I would be talking to your doc about getting some Pensaid lotion, and he's going to go, well, it's really only cleared for use on the knee. Jeremy, that's about the one place I never use it, okay, because it doesn't work that well on the knee, but it works beautifully on the hands and feet, okay, and the neck for that matter. But, yeah, that would be the way I would handle it. If you can see it on a bone scan, which was when I saw your call summary here, I'm thinking, this is an easy one. You just get a bone scan. Okay, well, they did it. And if it's non-displaced on the X-ray, then you don't probably need to pin it, but you sure do need to control the discomfort. So Pensaid lotion would be the way to go. So Jeremy, ask him to do that. If that doesn't do it, get back with me, and I'll see if I can't give you a couple keywords to use that may push things along in the right direction.